Actually, Mark Levin is off today. I'm Jerry Agar, broadcasting from high above Chicago from Mark's proud Chicago affiliate, WLS. You know, when the founders started this country, the idea of various states acting as laboratories for ideas rather than a federal government having an idea and just imposing it on everybody, whether it ends up working or not, was an excellent idea. It's still an excellent idea, and we have an example out of Hawaii regarding universal health care, to which we should all pay attention when threatened with national health care by Barack Obama and his party and too many of his supporters. I'm from Canada originally, and nationalized health care scares me. That's coming up next. So I mentioned a little bit ago the several states as experimental idea labs in America. That was the whole point in the beginning with the founders, rather than centrally planned government, the kind of thing preferred by Barack Obama. Let's take healthcare as the example. But we have a couple of experiments going on, and they're useful. One is in Massachusetts, and they're having financial issues. And the other was just a flat-out universal healthcare program for children. Does this not sound like what Barack Obama talks about? No, I just want to do it for the children, just for the children. You know how long it took Hawaii to figure out that it doesn't work? 7 months. And thankfully, after 7 months, when they realized it doesn't work, they decided to stop. That's kind of unusual, isn't it, for government to admit they made a mistake, it's not working, we need to move on. Usually they just say it needs more money. But here's what they found out. This was unintended, I guess, but not unpredictable. People were enrolling in the program no matter how much income the parents had, because what would be the point of paying for insurance for your children if the government was going to give it to you for free? Never mind the tax aspect of there's no free lunch. I mean, why would you do that? Dr. Kenny Fink, administrator for MedQuest at the Department of Human Services in Hawaii, said, people who were already able to afford health care began to stop paying for it so they could get it for free. I don't believe, he said, that was the intent of the program. Well, this is just absolute proof that you can be smart enough to get a medical degree, but still dumb economically and politically. You couldn't tell ahead of time that that's what people would do? Here's the example I used this morning on my show in Chicago. I have a car. I'm paying for it. I'm making the payments. I bought it. But what if somebody came along and said, no, we have a program where we give cars to people. There's no income barrier. It's not for poor people. It's just for anybody at all. Well, what do you think most people are going to do? This is the warning that we needed. This should be the canary in the coal mine for universal health care. Sadly, it won't. I'll get calls now from people, well, this is happening to me, and this is happening to me, and I need the state to look after me. You don't get it, Jerry. Jerry Agar in for Mark Levin.